Do you feel like you've overeaten this week? So, I'm a diabetes doctor and I prescribe certain medications every day in my clinical practice. One thing that was popping up on my For You feed was a dermatologist, so a skin specialist, who was talking about Schmozempic. So, I've posted about Schmozempic before on my page and I got shadow banned. But I'm here to tell you that it really is not what it's cracked up to be. Schmozempic is a GLP-1 analog hormone. I've been prescribing it for about since 2012, so about 10, 12 years. There's been different versions of the medication, but this particular version came out, I think, about 3 years ago, and it is a GLP-1 analog hormone. So it's a supercharged version of a hormone that we all make. A GLP-1 is a hormone that we all make in our stomach, and it helps us to feel fuller for longer. It also has effects on the brain to promote satiety, so the feeling of feeling full, basically. And people have been misusing this medication, particularly in Hollywood and also in the UK, in the private sector, such that it's led to a worldwide shortage. So I'm NHS clinic, obviously, I'm an NHS diabetes doctor, but I also have a private clinic. And the paradox is that I cannot prescribe this medication on the NHS to people with diabetes that need it because there's a worldwide shortage, and we've been told by the government and by NICE that we cannot prescribe it. But yet in my private clinic, which I have once a week, people turn up all the time and ask for it from me. So there's this big paradox. I have to say I don't prescribe it on the private sector. I'm very clear with my patients that ask for it that I won't give it to them on the private sector. I don't think it's fair. I also don't think it's a good way to lose weight. If you have terrible diabetes, and you are overweight and maybe you need an operation, like you need a kidney transplant or you need some cancer surgery, and you are too overweight or obese to have the surgery, then I think it's appropriate to prescribe it then, so people can lose weight, so that surgery is safer. But I don't just prescribe it for cosmetic reasons. I think that's really not appropriate. I think the risks of the medication in that situation for cosmetic reasons do not outweigh the benefits. So I'm a diabetes doctor and I prescribe these medications like Schmozempic all the time in my private practice and in my NHS practice. But my first line treatment to any chronic disease is always, always diet and lifestyle, always. And diet and lifestyle can be very effective. You need to lose about 5% of body weight to start to see metabolic benefits. And, if you can lose 10%, 15% of your body fat, that's fat, then you can reverse prediabetes, type 2 diabetes, fatty liver. And that's been proven again and again in many scientific studies. So it's not just my opinion. Drugs like Schmozempic and other new medications that have come out, you can lose up to 22% of your body weight. But the problem with these medications is you will also lose muscle, and that's really bad for you, and that's really bad for your long-term glucose control. There's also risks of pancreatitis, nausea, vomiting, depression even. So I'd be really careful if you're searching on TikTok for these medications. Really take all of this with a pinch of salt. Don't take advice from non-specialists. I can't say that enough. Skin specialists, bloody like college dropouts are promoting this medication and it's not on, and then social media tries to shadow ban me, who's a qualified medical professional with 4 degrees in this subject. It shadow bans me when I try and make informative, positive videos to educate people. So I'm just a bit irate. You know me, I can get a bit irate about these things. If you've got any questions or queries, then please comment and post them down below. I will tell you the truth. Please don't follow skin specialists who are talking about GLP-1 analogs. Please do not follow other random influencers who are talking about this medication. They have never prescribed this medication in their life. I've prescribed this medication regularly for the last 12 years. Many thanks.